this is my junior portfolio. Before moving into my junior year of nursing school, my nursing philosophy focused on qualities including honesty, comfort, efficiency, and accountability. Although I still find these important, my philosophy has changed a bit throughout the years. My nursing philosophy now includes comfort, collaboration, and integrity. Throughout clinical experiences, I have been able to see the importance of patient comfort and the need for collaboration in order to have patient success. I also find it crucial to have integrity as a nurse. Being able to be forthcoming, honest, and fair will also help me lead to a successful future as a nurse. These are some of my nursing courseworks that I've taken throughout my sophomore and the beginning of my junior year. These include nursing foundations, health assessment, pharmacology, fundamentals, informatics, development across the lifespan, pediatrics, parent and newborn, and finally, computations. Starting with the course Nursing Foundations, some of the skills I've developed include applying nursing theories to my own clinical practices, and I've learned the importance of principles, concepts, and their theories. And I've also learned that theories have set the standard in which we deliver patient care in all clinical settings. The strengths I've developed during pharmacology include paying attention to small details, understanding rationales and reasons, and I've learned what medications contraindicate one another, and I've also learned what medications to give in certain clinical situations to advance patient care. And finally, I've learned what to monitor when administering different medications. For example, some medications affect neurological status or even vital signs, so being able to understand what to look out for when administering certain medications will obviously help better my patient. For the course Nursing Informatics, the skills I've developed include locating credible sources that support my claim and researching abilities. I've learned what technologies help advance medical practice, and I've also learned the importance of assessing a patient's understanding prior to teaching in order to understand if there are language barriers or teaching barriers that will go ahead and kind of put a blockage between you and your patient. For health assessment, the skills I've developed include therapeutic communication, lab skills including inserting Foley's, NG tubes, enemas, or donning sterile gloves, and performing a full head-to-toe assessment. I've learned how to communicate with patients that are in a tough spot mentally, emotionally, and physically. And I've also learned how to properly study and to hold information rather than learn and dump, which was something that I struggled with my sophomore year with fundamentals and things of that sort. So being able to hold this information and kind of carry it throughout the rest of the semester didn't only help me be successful in class, but also successful when it came to finals. For the coursework Fundamentals, the skills I've developed include critical thinking and applying knowledge to clinical situations. I've learned the basics of nursing. I've learned how to find the best answer and not just the right one. And I've also learned how to prioritize patient needs, whether that is following ABCs, the Airway Breathing Circulation Protocol. For the course Development Across the Lifespan, my skills include better understanding and studying strategies, and understanding concepts at a fast pace. I've learned that the developmental process can impact how you deliver patient care, and I've also learned about different theories and how they apply to nursing. In pediatrics, the skills I've developed include therapeutic communication and play and distraction techniques. I've learned how to interact with children and also interact with the parents of the child. I've also learned how to apply developmental stages to my patients and how that might influence the path that I take when it comes to caring for them. For parent and newborn, the skills I've developed include being observant, empathetic, and aware. and assisting nurses with medication administrations, bed baths, temperature checks, vitals, etc. I've found that this was an especially important skill because it helped obviously take the load off of the nurses, and I was able to learn more techniques and just kind of be more confident when it came to simple daily tasks. I've also learned how to properly hold, swaddle, and bathe a newborn baby, and I've learned about many different birthing techniques and positions that one may use to advance during labor. And finally, for my computations course, the skills I've developed include understanding insulin concepts, fractions, and decimals, and I've learned the importance of reading a question thoroughly. I've learned why safe doses are so important to patients, especially children, and I've learned the importance of med checks before administration. For my non-nursing coursework, I chose 3 3-week classes that I've taken throughout my nursing path. Those include narrative bioethics, sociology, and nutrition and fitness. For the course Narrative Bioethics, the strengths and skills I've developed include researching abilities, counter-arguments, and public speaking. I've learned that there are many ethical issues in the medical field that still aren't being addressed, and I've also learned how to be more confident and open with my ideas and opinions. For sociology, the skills I've developed include understanding mental health issues, applying course material to my everyday life, and I've also learned that socioeconomic issues such as gender or racial issues are still prevalent in nursing today. And I've also learned how to address and notice issues that impact myself and patients. Finally, for nutrition and fitness, the skills I've developed include understanding macros, supplements, and different diets, and understanding the sports and physical demand on the body. I've learned the importance of eating properly based off of your physical needs, and I've learned how different macros are needed based on the sport you play. For example, if you participate in long-distance running, your body may need more macro than anything else, and if you run a short distance, you can go ahead and have different macros based on what you need. So far during my nursing path, I've experienced 3 clinicals, my first one being med-surg at UH Portage Hospital, and the 2 this junior year being maternal, newborn, and postpartum at Akron Hospital, and pediatrics at Akron Children. Med-surg was my very first clinical experience and rotation. It taught me the simple basics that I now use in every other rotation. It has also taught me how to administer medications, how to chart and document, how to measure vitals, how to perform bed baths, and just how to provide simply daily care needs. This clinical experience was significant in the sense that it helped me develop confidence and communication skills that I now carry with me into future and present clinical experiences. For maternal, newborn, and postpartum, this was one of my favorite clinical rotations thus far. Although for half of this rotation in labor and delivery, I was observing rather than doing hands-on activities, it was extremely informational. I was able to see things like vaginal births and C-sections. And though my favorite part of this rotation was postpartum instead of labor and delivery, I found both to be very interesting. Postpartum was something that I never found myself being interested in, but it holds such significance now. This is a unit that I can see myself being a nurse in, and this experience on this unit made me so emotional to just see the creation of life, and families become so happy with bringing someone into this world. For pediatrics, this clinical rotation was one of the most memorable by far. I was placed on a hematology, oncology, pediatric floor, so most of my patients were very sick. This experience taught me how to interact with patients of a younger age and also allowed me to be a friend to many of these kids who were lonely and couldn't have visitors or parents couldn't make time to come down and be a visitor. I feel as though this rotation holds most significance to me because it was super eye-opening. As hard as it was to be a student nurse on this floor and rotation, It taught me how much I have to be thankful for and how much my presence truly does affect the patient and how much it means to just be there. So going on to papers and projects that I've created during my nursing classes, my favorite so far is my nursing philosophy paper that I wrote my sophomore year. This is a part that I reflect most about in my paper. I stated, it has given me a completely different insight into what nursing is about and how each part of a nurse's role is reflected in the outcome of the patient. This paper is significant to me because it solidified my desire to be a nurse, and it also changed my view of nursing and what is expected of the profession. I think looking back, this paper has also kind of motivated me and given me a reason to keep pushing in a very challenging measure. For projects, I chose the mandala assignment that I also completed my sophomore year. This project is significant to me because it taught me about the 5 factors that play a role in patients' well-being. This theory by Betty Newman is something that I've seen within my clinical rotation, and it's inspired me to be a better nurse. On my left, this is an example that I drew out of the Betty Newman model. And I kind of chose this setup because I think it really highlights what she wanted everyone to know and what was important in her theory. For internships and study abroad opportunities, I have not had one to experience yet. I do plan on having an internship this summer and working at the City of Hope as a nurse tech. I feel that having an internship or a study abroad experience is beneficial to my learning, as well as helping me gain confidence in the healthcare setting and again solidify my reasoning for becoming a nurse. For leadership experiences, Eclectic Honors Program is something that I'm a part of. I was admitted into the Eclectic Honors Program at Hiram my freshman year of college. This program not only pushes me to work harder, but it also pushes me to challenge myself in courses. I've been part of this program for 3 years now, and I've helped set up events and mentor students who also wanted to be a part of the program or were struggling to be successful in the program. I've also been a part of the women's soccer program here at Hiram. I joined the women's soccer team my freshman year, and I'm still currently part of it. This program not only allows me to play the sport that I love, but it also has taught me many skills that benefit me academically, these including time management and communication. I've had to communicate between coaches and professors whether I was missing a class, a test, or practices, or any other kind of academic or athletic event. And this kind of has now helped me become super professional in not only academically, but also in clinical settings. Similar to study abroad and internship opportunities, I have no other nursing-related work experience besides my clinicals that I do here at Hiram. Although I don't have any experience, I would like to gain some, and I do plan on doing so this summer. And finally, the 2 awards that I've earned during my time here at Hiram is Dean's List. I've earned this in the winter semester of 2022. This award can be found on the Hiram College website. Dean's List is an award for students who maintain above a 3.6 GPA for an entire semester. I also was a part of accomplishing the highest sports team GPA. Me and my soccer team, we earned a 3.6 GPA during the season of 2022 and 2023. This can be found on the Hiram College Athletics page. And the athletics department calculates each team's combined GPA, and last year we had the highest sports GPA of both the men's and the women's team. I find this to be an extremely big